Diabetes and fatty liver disease. These have some similarities and obviously differences, but first I want to talk about diabetes. Diabetes, once diagnosed in an individual, we now know that that process of moving down the road towards diabetes has been going on in your life for many, many years, 10, 15, 20, even 30 years before someone actually gets the diagnosis of diabetes. So the early stages is called insulin resistance. That's when your blood sugars are spiking and your body is starting to put out more insulin to control that blood sugar. This is a very simplistic explanation, but there's so much spike in blood sugar and insulin put out that the cells become resistant to insulin, thus the name of the disorder, insulin resistance. The next phase is you move from the cells becoming resistant to insulin to a pre-diabetic state, and then ultimately diabetes. And even in the insulin resistant early stages, your body is being damaged on the inside. Your liver is being damaged. Your kidneys are being damaged. Your brain, your heart, your blood vessels are being damaged. So you can imagine if that goes on for 10, 15, 20, 30 years, there's been a lot of damage already occurring. And there are 37 million diabetic individuals in the United States of America and 96 million. That was 96 million pre-diabetic individuals. And most of them do not even know that they're pre-diabetic because we're not looking for it early enough and often enough in a widespread fashion. So what does all of this have to do with the health of your mouth? Well, as you can imagine, the presence of an altered health of your mouth or an altered oral microbiome and these dangerous bacteria and microorganisms not only makes it more difficult to control your blood sugar, especially if you're diabetic, but whether you're diabetic, pre-diabetic, insulin resistance, or none of those, it still contributes to this irregular spiking of blood glucose levels. And that's damaging to the body and will ultimately lead to these other pathologic problems, insulin resistance, prediabetes, and diabetes. The other thing is it's impossible to stabilize and reverse diabetes effectively if we're not finding all of the contributors. Yes, we know lifestyle is a huge factor in diabetes, type 2 diabetes. And type 2 diabetes is being found in children now, not just adults. But beyond lifestyle, we know that these microorganisms that are harmful in our mouth are playing a key role as well. Difficult for the diabetic patient to control their blood sugar and even normal individuals to control their blood sugar if they have these dangerous pathogens in their mouth. Yet, many people don't even know. They don't know that they're headed towards diabetes, and they don't know that they have an altered microbiome or that the health in their mouth needs attention. Because remember, you can have these dangerous pathogens in your mouth even if the gums look healthy and aren't bleeding and your breath is good and you like the way your teeth appear. 95% of individuals with diabetes have gum disease. So another huge interplay between the health of your mouth and diabetes. What about fatty liver disease? So fatty liver disease is very similar to diabetes in that an unhealthy lifestyle, even if it's non-alcoholic fatty liver disease, an unhealthy lifestyle is the main driver of fatty liver disease. And then you throw in the mix that you have these dangerous bacteria, dangerous pathogens in your mouth. Fatty liver disease is very difficult to treat and to reverse and stabilize unless someone spits in a tube and we check your saliva for the health of the oral microbiome and treat any dangerous bacteria that are present there. So diabetes and fatty liver disease, the prevention of these diseases, important reason to have the spit test. And then if you do have these diseases, it's impossible to thoroughly treat them and reverse and stabilize these pathologic processes and reverse and stabilize these diseases unless you spit in a tube, and we can improve the health of your oral microbiome. And then lastly, your health, even if you've reversed your diabetes or you've never had diabetes, your health will not be as vibrant. Your brain won't work as well. You won't have the energy you want. Your health will markedly improve and you will prevent these diseases with the information you're going to learn from having the spit test.